a 21st century approach, the 8 absolute essentials to great health. My name is Dr. Michael Veselak. I am board certified in integrative medicine and a certified functional medicine practitioner. Functional medicine works to identify the underlying cause of the disease process. It just does not treat the symptoms, but rather a whole body approach looking at each person as unique in its own treatment, its own symptoms, and its own plan. In our office, we treat a lot of different chronic health conditions like neuropathy, fatigue, stenosis, fibromyalgia, type 2 diabetes, thyroid conditions such as autoimmune Hashimoto's, complex regional pain syndromes, and rheumatoid arthritis. And with these chronic health conditions, it's really important that we identify what the underlying cause is so we can start to have improvement with our patients. The 2 basic questions when somebody comes to my office is, why do I have this condition and what can be done to get my health back? Health is really an optimal state of well-being. It's not just the absence of disease. Our current system focuses more on symptoms, not causes. It is really pharmaceutically driven and is more of a reactive model. It should really be called disease care. So we're going to talk about 8 absolute essentials to great health. And I want you to think about how many of these are you actually doing? The first thing that is super important is you have to control inflammation. You have to know, is it acute, chronic? Is it dealing with immune issues? Because inflammation is what really destroys the patient. There's certain lab markers we look at, like C-reactive protein, ESR, and homocysteine to determine the level of inflammation in the patient's body. So the immune system primarily is in the gut, 70 to 80%. The other 20 to 30% is located in the skin, the lungs, and the mucous membrane. And the brain has its own immune system, which is driven by the glial cells. So if there's a lot of inflammation in the body, it's hard to improve. Inflammation in Latin basically means ignite. And so if you think about it, if the house is on fire, you surely can't keep building around it. It's not going to really get better. So you have to control the inflammation. Some causes of inflammation are poor gut flora, gut infections, food sensitivities. You can have inflammatory foods such as lectins or wheat or dairy, or you can have leaky gut syndrome. So Hippocrates, the father of medicine, said all disease begins in the gut. Some other causes of inflammation are you can have a poor essential fatty acid ratio, the omega-3s to the omega-6s. Insulin resistance or high blood sugar, because insulin can be extremely inflammatory. Of course, autoimmune disease. We could have joint misalignments or joint destruction, which create a local immune response and an inflammatory reaction in that area, such as rheumatoid arthritis. So it's important that we don't suppress the immune system with anti-inflammatory medicines. You have to diagnose and manage the causes of the inflammation. Some of the ways to decrease the inflammation are the anti-inflammatory diet. So oftentimes we recommend the paleo diet. We try to remove certain foods that can be triggers, such as gluten, dairy, soy, sugar, and alcohol. Supplements that we recommend to diminish the inflammatory response is resveratrol, turmeric, boswellia, and L-arginine. And then we like to incorporate proper fats such as avocado, coconut, almonds. And then of course exercise has been known to lower inflammatory levels in the body. So the second thing of the 8 health essentials is proper digestion. So we have to digest food properly to convert that food to energy, so we must have good digestion and good absorption. A very common condition we see in our patients is hypochlorhydria, which is not enough acid in the stomach, which the patient who usually has acid reflux, which would make sense that it would be too much acid because there's burning, actually is a situation where they are hypochlorhydric, not enough stomach acid. So we'll often recommend different supplements like betaine, HCl to bring the acid levels up, which need to be at a very slow and deliberate rate to make sure not to cause any flare-ups in the patient. You also need, for proper function and digestion, is proper detoxification, the B vitamins, proper gallbladder, which helps emulsifies the fat, and proper pancreatic function for the digestive enzymes. Proper gut motility and brainstem function is super important because the brainstem basically controls motility rate. So our vagus nerve is our rest and digest nerve, and that is controlled by the brainstem. 3, we need proper cellular uptake of nutrients and macronutrients. We need proper fatty acids, amino acids, and glucose. So it's the way our body converts our fats, proteins, and carbohydrates. Also, a major player is insulin. So if you're insulin resistant or diabetic, this will play a crucial role in the uptake of these nutrients. The other important part is we need a very good acid-alkaline balance and not have that hypochlorhydria situation that we just talked about, not enough acid in the stomach. So with regards to diet, it's important to eat frequent protein-based meals. We need to exercise. We need to pay attention to factors like, are we fatiguing after we eat? There's a sign of insulin resistance if you are. The 4th thing that is important in the 8 health essentials is we must be able to convert the macronutrients to energy inside the cell. So the energy factor of the cell is the mitochondria. It requires vitamins and minerals and nutrients, primarily our B vitamins and CoQ10 and zinc. So if you're deficient in alpha lipoic acid, CoQ10, B vitamins, this could be an issue with having your body able to convert the carbohydrates, fats, and proteins into energy. And a real common cause of CoQ10 deficiency is the overuse of statin drugs, because it inhibits the production of CoQ10 in the body. The 5th essential element for health is you must have proper elimination. So a byproduct of all energy, which are basically fumes or free radicals, these must be eliminated. So when we have poor metabolism, this increases more free radicals or more fumes, and this creates a situation where we have more free radicals in the body, which create more fatigue, premature aging, and more inflammation throughout the whole body. Oxidative stress will then build up, and we need major powerful antioxidants like glutathione, which is the master antioxidant in the body. Also, antioxidants like CoQ10 and vitamin C, alpha lipoic acid are super important in controlling oxidative stress. For proper elimination, all these things need to work in conjunction. You have to have proper phase 1 and phase 2 detoxification of liver. The kidneys need to eliminate properly. Lungs with respiration. Skin as far as being able to, sweat. And gut motility and exercise are all very important when it comes to elimination. So why would exercise be important? Well, a couple things. It lights up our brain more than anything else. It improves the cellular uptake of our nutrients, so it's really important if you have insulin resistance to be exercising. It provides more energy helps with fat loss, and yes, you will lose weight. So what type is and how much should we do? Well, ideally, if we were able to do 20 to 30 minutes of cardio a day, that would be perfect. We want our heart rate to be 180 minus our age. So if we're 50, 180 minus 50, our heart rate, we should maintain at about 130 to get the maximum cardiovascular output. Also, resistance and strength training 2 to 4 times a week would be ideal. They have programs now that you can download on your phone, which is called the 7-minute workout, which gives you a high intensity workout, and it targets all the major muscle groups to help cardiovascularly and to start to build muscle. This, of course, will help to burn fat and improve your insulin resistance. So the 7th essential health element is you have to have proper sleep. So we've all heard that we need 6 to 8 hours continuous sleep, and it's important that your hormones be balanced, have no blood sugar issues, have a balanced autonomic system, that's the fight or flight versus the rest and digest, our sympathetic versus our parasympathetic system. All these are super important, and if they're imbalanced, will affect our sleep. So they all need to be addressed if we're not sleeping properly. Things like sleep apnea, that could be a poor brainstem function. And we have found it's greatly improved with brain-based therapy. Hypertension will also be affected by the brainstem. So the 8th and essential health element when it comes to functional medicine is you have to have proper brain function. So our brain is really our energy hog. It takes up 30% of our energy from oxygen, and also a lot of the glucose goes right to the brain. So basically, metabolic means when we eat food, it converts it to energy. And if we're not converting the energy, it's going to affect the brain. In fact, they're calling Alzheimer's type 3 diabetes. So things that can affect the brain are you need proper fuel, which is glucose and oxygen, and you need proper activation, which is stimulation. So that's why a good cardiovascular exercise or walking is good for the brain. So 70% of our brain is actually a brake pedal. And so we have 2 basic systems in our body. We have our nervous system, I should say. We have our fight or flight, which is our autonomic nervous system, and this is supposed to be a reactive, like fight or flight mechanism. So we only do it in terms of fear, and the rest of the brain really inhibits this system. It's off most of the time. So now certain things like the bodily functions we don't think about, respiration, heart rate, that's an autonomic system. Our limbic brain, or our emotional brain, is also a part of the braking system. So if all of a sudden we become more impulsive and more emotional and can't control certain behaviors, this can be the brake system is not quite working properly. So as I said, we have 2 parts of the nervous system. The parasympathetic, which is really our vagus nerve. It is our rest and digest. So if we're not sleeping right and we're not really, we have a lot of different gut issues, motility, constipation, then the parasympathetic could be a little out of balance with the sympathetic, which is our fight or flight. And they should be in perfect balance. And again, our body is designed to break the sympathetics most of the time. And when one becomes out of balance, we start to have issues with, anxiety or not sleeping well. So we only need the sympathetics when we're in a true fight or flight mode. Therefore, it is being, on hold or in a brake mode most of the day. And this is done by our upper brain, the frontal lobes, our basal ganglia. And when we have fatigue and or degeneration, we start to lose this inhibition or the brake pedal. So when the sympathetics become a little bit out of control, or we call it a sympathetic escape, these are some of the symptoms you might experience: migraines, chronic pain, fibromyalgia, blurred vision, insomnia, dry eyes or mouth, decrease in digestive enzymes, constipation, acid reflux, cold hands or feet, increased sweating or urination, high blood pressure, or vertigo or balance disorders. When there's a limbic escape, it's more, you have a decreased ability to focus, you become more irritable, have anxiety, have difficulty quieting your mind, you're constantly ruminating and thinking about certain thoughts, you might have depression, apathy, brain fog, and just not enjoying your life, even though your life is actually really good. So it's an inaccurate, disorganized thinking where you're not feeling loved, or you're feeling paranoid, or you're just feeling guilty about things. This is more of a limbic escape. So the good news is the brain can be changed. So as I mentioned, it needs good, proper fuel. That's in the form of glucose. So if you're insulin resistant or diabetic, this is an issue, or hypoglycemia. And you need proper oxygen. So if you're having issues with anemia, then this can affect the brain. We also need proper activation. So when we look at somebody, we want to address them not only metabolically, but also neurologically. So functional medicine is really a process. There's no magic potion. We must identify the underlying cause. Medicine these days really targets the single bullet approach. And I guess it started maybe with penicillin, when all of a sudden we took one potion that got, rid of some disease. And now you hear all these commercials, take this pill for this and this for that. We're all so used to just hoping that one thing's going to make a difference. And our body is so interconnected that you really need to address all the different systems to figure out the underlying cause. And when you do, then actually the body, it's amazing, it will improve. We also in our office, we like to look at labs, because oftentimes we have a patient come in and say, hey, my labs are normal, but I'm tired all the time and I just don't feel great. So functional medicine, what it does, it's a little bit more sensitive to reveal problems. We take normal lab ranges and we just tighten up a little bit. So we shrink the values a little bit so we can look at patterns. We really want to figure out the why. And we have a lot of patients that when we put their labs on a functional scale, all of a sudden we see this pattern of why they actually have the fatigue. We start to correct those little dysfunctions, the fatigue goes away, patient feels better, and their labs become more normal. So for instance, glucose. The traditional ranges are 65 to 110. Now that's a wide range. Functionally, it's 85 to 100. And I will tell you, if I have a patient that is, let's say 80, I ask them, if you go without a meal, do you start to feel shaky, or where you're just feeling like you're in a little bit of a brain fog or a little bit confused? And the answer is always yes. They're actually in a state of reactive hypoglycemia. So we like to, again, tighten the ranges up, look for patterns, try to figure out the why. So there's certain tests that we look at. Most of our patients have already had the complete blood panel, so there might be a couple of these markers that we like to look at that aren't part of the normal profile, like homocysteine. But normally the panels run, the normal CBC and complete blood panel are a good place for us to start. Occasionally we'll recommend salivary hormone testing to take a close look at the adrenal glands and cortisol levels and its relationship with melatonin. If we're thinking that there's a possible gut infection, we like to run a stool sample. We're using a company now called Vibrant Health, which actually puts out a great profile where we can look at possible gut flora problems, infections, or parasites. CYREX does some amazing testing with food sensitivity and chemical and autoimmunity that if we really need to look closer, and a little bit more in depth, they have several panels that we might run on a patient to really get to the bottom of the problem. And then we really like to look at the genetic testing. So we'll have the patient order their genetic test from 23andMe. We absolutely love the organic acids test. We feel we can get more information from that one test than any test we've ever seen. And I'm amazed that nobody has ever run it, and most people have never even heard of it. But when I put together the genetic testing with the organic acids, I feel like then we can really personalize the treatment for the patient and identify that underlying cause. And it just seems like it reveals the problem like we're almost looking at a blueprint of the body. Now, when you look at the genetic testing, everybody has certain issues. And it doesn't mean these genes have expressed themselves. So we look at different SNPs. They're called single nuclear polymorphisms. And what it really looks at is more vulnerabilities or perhaps susceptibility. And when we see a patient is maybe having this vulnerable issue in a particular area, such as, let's say, detoxification, we then correlate it with the organic acid and we look at, let's say, a marker like pyroglutamate to see if they're perhaps producing the glutathione, which is our major antioxidant, which can help the detoxification. So when we correlate the two, we really feel like, you know, again, looking at the complete metabolic panel, that we can really address the patient's symptoms and really get to the cause of their problems. That is true functional medicine. In our office, what we've seen is all chronic health conditions have some common thread. So what I mean by that is when on the left-hand side of the page, you see all these different conditions: thyroid, type 2 diabetes, fibromyalgia, peripheral neuropathy, stenosis, celiac disease. Every single one of those, there has to be a metabolic imbalance. And in truth, a neurological imbalance which creates that decreased frequency of firing in the brain. And when you start to address the metabolic imbalance along with the neurological imbalance, there'll be improvement of conditions, even things like stenosis, peripheral neuropathy, fibromyalgia, which there was a period in my practice where I never thought these conditions would improve. And now we're getting tremendous success really on a daily basis with these kind of patients. So, in essence, functional medicine is a roadmap to a better life. As you all know, and we've all heard, that health is our greatest asset. And sometimes we don't realize that until we actually get sick. But functional medicine and functional neurology is, in my opinion, the only type of care that will get the chronic sick better. Our health system is really based on that reactive, acute care model, and really the United States is better than any country in the world as far as the acute care model. When it comes to chronic care, we need a lot of help. Most doctors don't want to address that chronic health issue for a lot of reasons. One, it takes a lot of time. It takes a lot of time to figure out that underlying cause. But functional medicine, that's what it's suited for. It's suited for the chronic patient, the fibromyalgia patient, the vertigo patient, stenosis, peripheral neuropathy, autoimmune issues. When it comes to supplements, I can't tell you how often patients come to my office and they just, they're getting the supplements from Costco or from CVS, and they're just not good quality. So what you're putting in your cells are all these things that aren't great for you, as well as the few things that are good for you, and I would say they're probably counteracting each other. So if you're going to invest in supplements and really want to take something, take good quality. We only use the best supplement companies really that are out there. We try to get the best nutrition into those cells to make the most amount of impact that we possibly can. And it's our goal not to put you on a bunch of supplements. It's basically to find the cause, reduce the amount of supplements you're taking, and really, when you pinpoint the reason why, which I said I love the genetic and the organic acids, I've reduced those supplements for sometimes like 8 to maybe 1, 2, or 3 with much, much better, faster results. So here's some clinical pearls. Detoxification occurs over 1 trillion times per day in our body. You just can't go on a detox diet for 3 days and make a change. It's happening all the time. You need to make lifestyle and dietary and nutritional changes to have an impact. So this begins with the gut. So we like the anti-inflammatory diet. We use certain products like GI Health Essentials from genetic nutritional formulas that has L-glutamine in it. It helps to repair the gut. You have to remove the bad bacteria, the parasites, and or the fungus, and then restore the gut with a good probiotic or prebiotic. And the prebiotic actually helps to feed the probiotic to maintain a healthy environment. Again, this is why we like the genetic testing. There's a marker on there that tells us, does the body not maintain the probiotic level in the tissue lining? So in that situation, if we see that, we absolutely need to give the patient a prebiotic to make that lining better, to allow the probiotic to stay in there and the good bacteria for longer periods. Some other clinical pearls are, we need to layer in parts. You just can't do everything at one time. What we've really found out is when a patient comes in, they're chronically sick, you need to start with the foundation and slowly build up. Otherwise, if you give everything at one time, the patient's going to flare up. So we address the liver for detoxification. We want to address the adrenals and, of course, the mitochondria for fatigue. We want to look at blood sugar, anemia, as I mentioned, super important for brain overall health. We're really been focusing a lot on the mitochondria level. It not only has to do a lot with energy, but I believe when the mitochondria is functioning right and it's improving the methylation cycle, that our body just functions at a higher level. And this is really how we've been attacking a lot of these chronic illnesses like Lyme's lately. And also, you need to support the immune system with things like vitamin D, omega-3, and turmeric. With regards to acid reflux, again, we recommend an anti-inflammatory diet. We like to address the hyperchlorhydria issue, look at lactic acid, sometimes recommend digestive enzymes, and we need to balance out that acid-alkaline balance and the pH. So we like it right around that 6.0 to 7.2. So we'll have our patients do a pH strip in the morning just so we can analyze where their pH of their urine is first thing in the morning. Brain fog is becoming more and more common, and I have a lot of patients in my office that have, the early signs of perhaps dementia or Alzheimer's or Parkinson's, and we're all about detecting these neurodegenerative diseases prior to them actually manifesting themselves. By the time most of these are diagnosed, the truth is it's too late. So we want to look at what triggers, is it diabetes? Is it the gluten, dairy, soy, sugar, alcohol? What supplements in the brain can help decrease inflammation? We like to look at resveratrol and turmeric, and we do a complete neurological evaluation to evaluate the different lobes of the brain. Again, we want to make sure they're inhibiting when they should be inhibiting, and there's not that sympathetic escape, and that things are in that nice checks and balance. So we really get to the bottom of the neurodegenerative issues, and we try to address, I would say, those neurodegenerative conditions before they really manifest themselves. These days we're seeing more and more patients with anxiety. So there's a lot of things you want to look at. First, the genetic testing tells us a lot about, is this patient susceptible to anxiety? There's a marker on there, it's called the GAD. It breaks down the glutamates. So you want to look at, are they putting in certain glutamates into their system? So we've all been taught monosodium glutamate is not good for us, so we started to avoid it, but the food companies decided to hide it in several different labels. So take the time and Google glutamates, food labels, and you'll come up with, I can't recall if it's 13 or 18 different names that they hide these glutamates in that just are not good for you. And we all know diet sodas, the aspartate and aspartame is just not good for us. We want to look at the adrenals, are they overtaxed? Are you always in fight or flight mode? Are they releasing your catecholamines too much, the epinephrine and norepinephrine? We want to look at the brainstem function because it controls the autonomics and make sure that feedback loop is working, that we are getting the inhibition. In our office, we do things like neurofeedback to control anxiety, along with the dietary changes that I just mentioned. We stimulate the vagus nerve through different brain-based exercises, and we'll use actually electrical stimulation to stimulate the vagus nerve. And these have proved to be quite effective in controlling anxiety. In fact, our success rate right now is 100%. When looking at autoimmunity, you have to maintain the balance between the Th1 and the Th2, the acquired versus the adaptive immunity. The Treg cells help this, so things like vitamin D, omega-3. We love nitric balance to control the nitric oxide levels for inflammation. It's a product by Apex. We recommend our patients eat paleo or sometimes a low FODMAP diet. And I want you to know that with autoimmunity, it can't really be reversed, but you can modulate. You can have zero symptoms and still have an autoimmune issue if you're modulated properly. So I want to thank you for listening. If you have any questions, please email me at Dr. Veselak, Veselak, @gmail.com. You can always go to our website, drmichaelveselak.com, or visit us on Facebook at Camarillo Functional Health. If you're interested, call for an appointment, 805-482-0723. We see a lot of distance patients, and in fact, all over the world. We consult with doctors as well as patients. So if you're interested in pursuing the genetic testing and having the interpretation, please go to the website. You can book an appointment through there, or you can call us at, again, 805-482-0723. Thank you so much.